Okay.
Okay, so what I would do first is I would check the patient's medical record and just make sure I know everything that I need to about the patient, make sure they don't have any restrictions, do I need to wear PPE, things like that. Once I've done that, I would gather my supplies and perform hand hygiene, 20 seconds or more. Then I would go into the room and I would identify the patient. So, sir, can you tell me your name and date of birth?
John Smith, January 1st, 1980.
Okay. All right, and check the chart, and I would check his armband, and all right, we're all good to go. So, Mr. Smith, what I'm going to be doing today is I'm going to be taking your bandage off your wound. Then I'm going to be cleaning that area. Then I'm going to take a sample of your wound just with a Q-tip, just touching to your wound, and that goes down to the lab. They're going to take a look at that. Then I will put your medication on your wound and put a fresh bandage on it, and then we'll be good to go. So first thing I'm going to do is I'm going to take the bandage off. So I've already raised the head of the bed. We're going to pretend there's still a bandage on here. So I would raise the bed to working height, and I'd also make sure that the patient was positioned in a comfortable way, also so that the leg with the wound is close working area to me. Okay, so first thing I would do is I would put on a pair of clean gloves. And then I would work on taking the bandage off, and I would do the push-pull method, where I would just carefully, gently start to take it off. And once it's loosened enough, you want to pull in the direction that the hair is growing so you don't pull any of the hair out. And I would dispose of this. What I would do now is I would look at the wound and I would see if there's any drainage, any odor, what color is the drainage, how much drainage, what do the edges of the wound look like. I'd also be looking to see if there's any tunneling, any necrosis, any of those things, new skin growing. I would also measure the wound, see how many centimeters it is. Okay, 2 centimeters. And I would also, if it's a wound that's like deep, I would use a Q-tip and measure how deep the wound is. Also, you wouldn't just do length like I did, you would also do width. So once I've done that and I've documented all my findings, now it's ready to be cleaned. So I would take off my gloves that I have on, and then I would throw them away. Okay, so now what I'm going to be doing is I'm going to prepare the sterile field, because this cleaning or irrigating the wound is a sterile procedure. So I would start with the sterile field, and of course you're opening everything away from you, throwing away things you don't need. I would have had a garbage bin placed somewhere nearby me so I don't have to be moving around. Touch the corners, make sure it's not touching me at all, or the patient's leg. It's a little tricky, especially because the fan is on right now. Okay, so remove that, touching the corner. Okay, it's okay if you're, yeah, it's fine. Okay, so now that the sterile field is ready, I have to drop a few things into the sterile field. I'm not turning my back completely to the sterile field. I would probably have these things on a table a little bit closer to me. So later I'm going to need the ABD pad. So opening away from me, dropping from 6 inches. There's that. Also going to use the gauze sponges. So again, opening away from me and emptying out. What else? Also, I'm going to open this up. Keep this upright. I'm gonna go ahead and put my mask with face shield on because there can be splashing and stuff when you're doing irrigation, so you don't want to have any of that on your face. What else? I'm just gonna get my Q-tips closer to me for later. Keep this close by. So you're also going to pour the saline into the bottle, making sure the lips of the lid are facing up, and then you would go ahead and pour this in. So now I'm ready to put on sterile gloves. So how I would do that, I'll just move some of these things so you can kind of watch me do it. Again, I'd be doing this on a table. I wouldn't be doing it on the sterile field, but very close by. So you would open it away from you. And I've got this, throw this away. Open this package, just touching the corners. Okay. Only touching the inside cuff. Okay, so this inside is sterile, but so I can touch it. Okay, so now that I've got sterile hands, wound is ready to go. I'm gonna go ahead and use my left hand to touch things that aren't sterile. So I'm gonna go ahead and grab this, bring it closer. Grab this. This is gonna be the basin to hold, that's gonna catch the water. So now what I'm going to do is I'm going to suck out the water, the saline solution, and going over here. The basin's gonna touch under the wound. It's not touching the actual wound because this isn't necessarily sterile. So now I would start slowly, I'd start splashing the area with water quickly, and I would just keep doing this until the area, like the saline, runs clear again. So we're gonna pretend, all right, it's all clear, so that means the irrigation's done. So I'm gonna go ahead and get rid of these things. And then I would take one of the gauze pads and I would dry the area. I've already caught myself now. I will say I would have wanted to use my, I think I would want to have used my right hand because that's my hand that's still sterile. Even though I'm not touching the part that's touching the wound, so maybe I would have been okay with my left hand. Okay, anyways, now the area is dry. I'm going to throw away that. I'm going to take off my gloves and we're going to move on to the next step. So I've thrown my gloves away. I'm going to go ahead and take my mask off because the irrigating is done. I'm going to perform hand hygiene. Also, while we're at it, I'm going to take some more of my saline and I would just, yeah, I don't think I need a sterile field anymore. So I would just go ahead and take one of the pieces of gauze I haven't used yet, and I would get it moist with the saline because I'm gonna need this soon. So now we're gonna pretend that's wet with the saline solution. Okay, so I performed hand hygiene, so now I'm gonna get ready to take a sample of your wound, Mr. Smith. So how I do that is this time I just need clean gloves for this procedure because my gloves are not going to touch the wound area. The only thing that's going to touch the wound is the sterile Q-tip. So we are going to pretend that this is the tube that holds the sterile applicator for the sample. So I would twist and take the cap off, then making sure to not have the Q-tip touch anything else. Slowly take it out, and then I would go to the wound area and I would carefully, gently twist like kind of roll the Q-tip back and forth through the wound area, making sure that like liquid's coming out of the wound and it's saturating the Q-tip. Once that's been done, I would carefully, without touching anything else, put it back into the tube, making sure it doesn't touch the outer part of the tube, because the outer part of the tube is not sterile. Okay, so now it's in there. I would go ahead and close up the tube. Then I would probably take one of the patient's stickers that says Mr. Smith and all of his information, label the tube. We're good for now, so I'm going to put that to the side. Now I'm going to go ahead and take off my gloves because the final step of this has to be used with sterile gloves. So I throw these away, and we are going to pretend that these gloves are from a sterile package. So we're going to pretend that I did the whole procedure of opening up the sterile gloves and putting them on, making sure to not touch the outside. Also, I've already done hand hygiene, so now I'm putting on my sterile gloves the correct way. So now that I've got my sterile gloves on, what I would do is, if you had any medication, I would put that on your wound. I would also put any like skin protectant on the wound, like surrounding the wound, so for the new bandage your skin will be protected. So now that I've done that, I'm going to take that piece of gauze that we worked on earlier that I dunked it in saline, and I'm going to go ahead and put it on your wound. This isn't a deep wound, so I don't really need a Q-tip to like pack it. I'm just going to kind of put it right here, and the wound is covered at least an inch past the whole wound. So now that that's on there, I'm going to go back to my ABD pad, and with the blue line side up, I'm going to put that over the wound and the dressing. So what I would do then is I would take this tape and tape it on the patient. I'm not going to do that to you though.
Thank you.
You're welcome. In reality though, if you were a real patient, I would do that too. Also, so now that it's all taped up, I can take off my gloves and throw them away. I would take another piece of tape, and with a permanent marker, I would write the date and time and my initials on the tape, and I would tape that here just to document who did the, you know, rebandaging and when it was done. And then I would perform hand hygiene, and I'd be done. That's it.